Welcome back to CEEN Caribbean News. Time now to go in depth. In 2014, chikungunya was a hot topic in the region, with chikungunya wreaking havoc on countries like Jamaica and Trinidad and governments installing measures to control the painful illness. At the end of the year, however, silence replaced the hot buzz on the health matter that left a trail of scare among citizens of the region. And fast forward to 2015, the new buzz surrounded the outbreak of measles in the United States, with fears it could return to the region following its eradication from the Caribbean since 1991. We have been joined on Indepth via Director of Surveillance, Disease Control and Prevention at the Caribbean Public Health Agency, CARPHA, Dr. Babatunde Oluwakure, to give an update on the state of chikungunya and measles in the region. Welcome to Indepth, Dr. Oluwakure. Now, where is the region at this time in regards to chikungunya prevention and control?
If we look at this in terms of the numbers of samples that CARPHA is receiving for testing and the reports that we are receiving from the member states, then we would surmise that the current chikungunya prevention and control measures are resulting in a downward trend in terms of the number of cases that are being reported, and that we are seeing a lessening of the pressure on healthcare services in relation to the acute cases of chikungunya. There are some patients, and you will see an increasing number of patients experiencing the chronic effects of chikungunya, and these are related to joint pains, to swelling of the limbs, and maybe some difficulty in mobilization. So in general terms, overall, we're seeing a downward trend in the acute number of cases, but we would be anticipating now people should be preparing to see an increase in the number of chronic cases.
Now, recently, the head of CARPHA, Dr. James Hospedales, cautioned that within a few years, the region is expected to experience another massive outbreak. What encourages that viewpoint?
So normally when you have a disease such as chikungunya, which causes an outbreak or an epidemic, you are, and in particular in the Caribbean region where we have not previously had the experience of chikungunya, what you see is you have 100% of people are what we would call susceptible. That is, their immune system has never previously encountered this virus, and so therefore everybody in the population essentially can become infected. After a period of time, you would see that the majority of people in the community who can become infected have become infected, and the number of cases, as we are currently seeing, will start to tail off. And this may be seen for a number of years. The exact period we don't know yet, but usually seen for a number of years, 3 to 5 years. And then after that period of time, you now have an increased number of people who are susceptible to the virus, and if it's reintroduced into the population, you will see a big explosion in the number of cases.
Now, Dr. Hospedales also notes that the agency will be embarking on a study related to chikungunya. What is the aim of that study?
So what we will be doing actually are a number of studies. The one that he was probably referring to is what we would call a cohort study. Now, what a cohort study does is it takes a group of people who have had a certain experience, and in this case, chikungunya, and we are going to follow them up over a period of time. And so for us, that would be around a 5-year period, in essence, in the first instance, just to say, okay, these people who have had chikungunya, what has been their progression in terms of the disease progression in the chronic phase, or have they had any disease progression in the chronic phase? Are they experiencing joint pain? Are they experiencing symptoms? Are they unable to go to work? How much has the disease cost them in terms of economic costs? And also looking at potentially the psychological impact of chikungunya on this particular group of people, because chikungunya has a number of psychological impacts, including depression is one of those, because people are no longer able to function as they used to do.
On March 3 to 5, CARPHA hosted a consultation on chikungunya. What are the conclusions coming out of that meeting?
that consultation actually was very, very important. It brought together the majority of the member states in the region. We had our technical partners, PAHO, US CDC, Public Health Agency Canada, Public Health England, and several others. And also a number of partner organizations were there. And what we found from this conference is that, which was asking us about what the future would look like, is communications need to be improved, because we have a lot of people whose belief system has told us that they don't believe that the mosquito is the cause of chikungunya. And so therefore we have work to do in that particular area. We also need to look at doing vector control, and we clearly have a number of methods that we have been using for many years, such as using insecticide spray, either in the household or doing one from the back of a van, which is carried out by public health. How effective is this? So these are questions that we need to know the answers to. What other methods are there? And a number of those methods were discussed at the meeting. We also need to do a lot more research in this particular sphere, this particular area, because there are many unknowns with regards to chikungunya, as well as to the mosquito itself, which is a cause of the transmission of the disease, because I'm sure you're aware that the virus is carried by the Aedes aegypti mosquito and Aedes albopictus, and so therefore that can be a problem. So really looking at interrupting transmission is the main thing, and the outcome of the meeting was saying we need new and innovative measures in order to do this. And we also talked about using mobile phone technology as well as a means of identifying hotspots where the mosquito may be, and also where a high number of cases of chikungunya may exist.
Changing course a bit, with a recent measles outbreak in the United States of America, focus has been placed on preventing another outbreak of the disease in the region. Countries like Jamaica have ramped up their vaccination campaigns to guard against not just measles, but mumps and rubella as well. What are the measures implemented by CARPHA region-wide in the same regard?
In terms of this, in terms of the measles outbreak that has been happening, so what CARPHA has been doing is when we were made aware of this, we provided an alert to our member states. We informed them of measures they should take, and immunization, which Jamaica has, as you have used as an example, which Jamaica has done, is one of those examples. Clearly, we do not want the reintroduction of measles into the region. Measles can be quite a serious disease, and if you have a lot of people within the population who have never encountered measles before, then it can go through pretty quickly in a way similar to chikungunya. But also, CARPHA has conducted testing on samples where people suspect that there might have been somebody who had measles, and thankfully at this stage we have not had anybody who has tested positive.
Now finally, with some African countries declaring that they are Ebola-free, is the region still on high alert against Ebola?
In the Caribbean, although we have had no cases, and CARPHA has said that the current risk of an imported case to the region is low, we still need to be alert. There are still cases occurring in Sierra Leone, which does not have its current outbreak under control, and also cases still occurring in Guinea. So there is still potential, although it has diminished, for a case of Ebola to occur in the region, but the risk is low, and we should still maintain a sense of alert and readiness for this. And preparedness activities still continue, and so CARPHA is working together with the member states, with PAHO, as well as other public health agencies, to ensure that member states continue their preparedness activities, and CARPHA will also be supporting those.
Thank you very much, Dr. Olawakure. That was Babatunde Olawakure, Director of Surveillance, Disease Control and Prevention at the Caribbean Public Health Agency, CARPHA, speaking of the state of chikungunya, Ebola preparedness and measles in the region. Stay tuned for sports.